Hello, my name is Dr. Danya Bushwereb. I'm a consultant family medicine, Abu Dhabi, and today I'm going to present treatment of constipation. The reason why I chose this subject is very important. It is for professionals, as for doctors and nurses, but also like if you're not a doctor and you suffer from constipation, or if you have a family member who suffers, you're more than welcome. Hopefully you will benefit from this lecture. So I'm not going to go today into all of the causes of constipations because there are different causes, but I'm going to go straight to the treatment. It's as doctors, as family doctors, it's something very common. We always see like patients with constipation asking for a tablet, and doctors always try their best to give the best optimum treatment. And sometimes like we jump on giving like a tablet just to solve the problem quickly, but actually if you read like all of the researches and all of the studies and even like the national like UK guidelines and American guidelines, they don't really advise for giving a tablet straight away, although sometimes we have the urge that we need to give something just of course to solve the problem of the patient. But starting with simple steps such as like, for example, advising that, well, you need to eat healthy, balanced diet, having regular meals, increasing your fiber intake. So fiber intake, it has to be minimum like 30 grams of fibers per day, such as like eating like loads of fruit and vegetables. So sometimes like people will say, well, if somebody is suffering from constipation, they will say, well, how can I have like 30 grams of fiber? 30 grams of fiber, you can get it very easily if you eat oats in the, like for example, if you have them like as a brunch or even in the morning. 10 grams in just one bowl of fibers you can get. And then you have also avocado, which gives you almost 7 grams. A pear gives you like 3 grams, and this is a meal of 25 grams of fibers, which is pretty good. It's almost near to 30 grams. So just one bowl of oats, and then you have like 1 kiwi, 1 orange, and half a cup of cooked beans. If somebody doesn't like kiwi or orange, maybe they can have strawberries, pears, prunes, apples, anything instead, any fruit or vegetable. And that's it, you got like your 30 grams of fiber. Also, like having like fruit with high level of sorbitol, it shows that it's good for relieving constipation and moving the bowels. And actually sorbitol, it works a bit like a laxative. So what are the fruit with high level of sorbitol? For example, apples, grapes, raisins, apricot, plums, especially if it's dried, like prunes, pears, peaches, strawberries, raspberries. I have a few patients, they don't like taking like tablets. They're not a tablet taker. They don't like taking laxatives, and honestly they swear by prunes. They say it works very well. Once they take it, they eat a bit of like dried fruit. After that, they don't have any problem with opening the bowels. So that's something actually we need to advise. Just make sure that these patients are not diabetic, because like as you know, like fruit with dried fruit, it can have like a lot of sugar in it. Drinking adequate amount of fluid, like minimum like 2 to 3 liters of water. Exercise, whether it was like just mild exercise like walking or just moving around the home, for example, like cleaning. That can be like some kind of activity, and even like doing like cardio or hardcore. All of this will help, like it will help the bowels becoming regular, and it will prevent like constipation. Toileting routine, it's very important. We tend to forget about it, but we have to actually, if you're a doctor listening, you really need to advise about that, because the posture of exact is very important. So as you can see, this is the normal way which most people like sit in, because that's how the toilets are. But as you can see here, this is very bad. This can lead to constipation. Why? So around this is the back passage, and then of course you have here like the rectum, the anus. You have like a muscle here around this. So sitting in this position, in the 90-degree position, it's very bad, because it will lead to it will put more pressure. It will like constrict, and it will close and choke the back passage. So the muscle around here, around the back passage. So sitting like in a position where you're squatting, like the old-fashioned way, like the old Arabic toilets, and also you'll find them like in in old like fashion Arabian homes, or even like Indian, they use it a lot. So that's actually the healthy way with squatting. Why? Because squatting, it will the muscle around the rectum, there's no like it will be actually relaxed, and there was no there isn't really pressure around the back passage, and that can help like in defecation to be completed. Now, a lot of people say, well, I mean, most like modern houses, we don't have this kind of toilet. We have this toilet, so how can we mimic the same thing here? It's very easy, just by buying like a small step and put it like beneath your feet, and that can make you like sit in a 35-degree, and that will be like very similar to this position, to this posture. So it will be squatting here. So where can you get this step? You can just buy it from Amazon. Just buy, like, for example, right, I want a step, and just put it in the toilet, and teach, even if you're a father or mother, and just teach your children to sit in a healthy way, because this is the healthy way and this is the unhealthy posture. And then, of course, advise on responding immediately to the sensation of needing to open your bowels. And for hospitals, they need to make sure that, or any other places, like, they need to make sure that there is like there is people with limited mobility, they have access to toilets. And if you're a doctor and you're listening, it's very important to make sure that your patient doesn't have, he's not on any medication which can cause high calcium, especially in elderly people who have like osteoporosis or osteoarthritis. They tend to get like calcium and vitamin D sometimes in combination, and they just like, without even like sometimes checking their blood, which they just tend to ask for refills. Like sometimes even the daughters ask, or their sons, they ask for refill, and we tend to give them, but on the long term it might lead to hypercalcemia. So if they have constipation, sometimes doing some bloods and checking for calcium, it will be a good idea. So what are the medication for short duration of constipation? So we spoke earlier about like healthy lifestyle, about how to do exercise, drink water, what's the healthy posture. Now we're going to speak about medication. If all of that failed, we're going to go straight to medication. So if somebody just has constipation just for a short term, they're not known to have constipation, you need to give them some treatment. But if somebody always have lazy bowels, always have a problem for a long term, in this case, of course, we're going to speak about the other treatment, which is a bit similar to be honest, like to the treatment which we're gonna speak about now. So the first thing we need to offer bulk forming laxatives such as fiber gel. That will be the first line. Why? Because it has a lot of fibers in it. I know it doesn't taste very nice, but that's the first line we need to give them. The second thing, what we can give another type of laxative, such as Macrogol or Movicol. So Macrogol, actually, it's a stool softener. So you have two types of laxatives. You have the stool softener, something which makes the stool soft, and then you have another thing which is the stimulant, and that will stimulate the bowels and help like in opening the bowels. But the problem, of course, with stimulant laxatives, that on the long term it can the bowels can get used to it, and as we know, like, bowels have memory a bit like the brain, so they can get used to it, and on the long term it can lead to something called lazy bowels. So patients will say, well, I can't really open my bowels until I get that tablet, the stimulant, which will stimulate my bowels. So we shouldn't really start with the stimulants straight away. We need to start with something for a softener. So a softener, like, as I said, like Movicol. And then after that, the third step will be like giving like something to stimulate, like Senna or Bisacodyl. Regarding docusate sodium, that's another one. Docusate sodium, actually, it has both. It has this, it has like it softens, but also it stimulates. So it has two things. But the rest, the Senna, Bisacodyl is a stimulant, and Macrogol or Movicol, it's the softener. How can you know actually if the patient needs like sometimes if they need a softener or if they need a stimulant? Sometimes doctors can do like a rectal examination, like check like from the back passage and see if the stool is hard or if it's soft. So if it is hard, we need to give something to soften it. We can give Movicol or docusate sodium. And if the stool is soft and they didn't open their bowels, for example, like for a few days, maybe like giving them something to stimulate on the short term, like Senna or Bisacodyl, can help. If the patient has constipation because they're having an opioid, for example, they're having like tramadol, they're having codeine, they're having morphine or anything like this, which is causing constipation, do not offer them bulk forming laxative. You shouldn't really offer them like Fibrogen. So that's regarding the short term. Regarding the long term, again, it will be a bit similar. Long term, sorry, constipation. It will be a bit similar. You're going to start with bulk forming laxatives such as Fibrogen, and then of course you're going to give like the softener like Movicol, and also like you can add after that this the stimulant laxative such as Senna or Bisacudyl. And of course, doing like a rectal examination, it will really help, because rectal examination, it will give you an idea if the stool, if it's hard or if it's soft. So as I said, like if it's hard, you should make it softer. If it's soft, of course, you need to start straight maybe with the stimulants, laxative, to help like the bowels to move. And then that's the same thing if somebody is having constipation secondary to an opioid, like tramadol, codeine, or whatever. You shouldn't really give them Fibrogen. If somebody tells you, well, like for a few days, like more than a week, I didn't open my bowel. So and you examine their tummy and you find like actually they have like you can feel like their tummy, like on the left lower side, like, well, there is a bit of pain and tenderness, and it could be maybe like a fecal loading. So in this case, of course, you need to do like a rectal examination if you're a doctor, and you need to check, well, if it's hard stool or if it's soft stool. And then after that, on top of giving them like the tablet orally, giving them Movicol, and also giving them like something like a stimulant on top of that, like Bisacudyl, or giving them Senna, you even need to give them like a suppository. For example, it could be glycerol on its own, or even like you can give them a mini enema, like mini enema of Docusade, or and even like, so at the end you might even give them like a phosphate enema. So make sure like that when you have a patient with constipation, first of all, you need to know, is it a short term, is it a long term, are they on opioid, or they're not taking opioid? So these things you really need to ask about it, and make sure that, are they like following like are they following like a healthy lifestyle? For example, are they moving? Are they doing any physical activity? Are they consuming any fruit and vegetables? Are they practicing like the healthy toileting? For example, how is the posture when they're sitting on the toilet? So double check about all of that. And then after that, start with the, if you want to start medication, start with the simple medications after like doing like a rectal examination, and then you can give them even mixture sometimes of softener and stimulant, but please don't give them a suppository or an enema from the beginning, because if you give them, for example, imagine if somebody has hard stool and they didn't open the bowels for a few days, and you give them a suppository or you give them an enema, what will happen? It's not really like it will not be a good idea, because if you give them an enema, the enema will... So if you're a doctor listening and you have a patient with constipation, please don't give them an enema straight away, because, for example, if somebody has like constipation, they have like hard stool, and you give them like an enema or suppository, it will only relieve the hard stool, which is like in the end of the bowels. But the bowels, all of the large bowels, the large intestine will be full of stool, so it will not really relieve the problem. So starting from the beginning with, as I said, like small steps about healthy lifestyle, exercise, simple stuff, and also like adding, if it has been for a few days, adding even something to soften in the stool and something like to stimulate a bit the bowels, and you can even add at the end an enema. But just giving an enema is not really like, it will not really treat the problem. So hopefully like you benefit from this video, and please, if you have any questions or anything, please write them down in the box.